Homeostasis represents a state of coordinated biological balance. When that balance fails, organized cells collapse into rapid structural mutation. To understand the nature of this collapse, we rely on the discipline of pathology. The term derives from the Greek roots pathos, meaning suffering, and logos, the study of a subject. Medical education typically begins with the preclinical sciences, the study of normal human anatomy and physiology. This eventually transitions into the clinical phase, where the focus shifts to the management of patients in wards and clinics. Pathology sits directly between these two phases, acting as a vital bridge connecting laboratory theory to clinical practice. Without this specific scientific vocabulary, a clinician cannot accurately track how normal biological function deviates into active disease. Historically, studying disease focused on investigating disordered function within the laboratory. This environment prioritized scientific apparatus and biological isolation over direct patient interaction. In contrast, the management of actual illness occurs in wards and clinics, where clinicians address the immediate needs and physical signs of human patients. Pathologists operate as the crucial diagnosticians who translate findings between these two distinct environments. General practitioners and specialists rely on the precise laboratory reports generated by pathologists to institute appropriate treatment and preventive measures. Novices often assume that a patient exists in a binary state. They are either strictly healthy or they are sick. In strict biological terms, health is defined as a condition where the individual is in complete accord with their surroundings. Disease represents the direct opposite, a loss of ease or comfort within the body. These concepts occupy a wide, continuous spectrum of normality, where health and disease are viewed as relative states. This relativity extends down to the cellular level. Cells undergo a progressive shift as biological stress increases, moving gradually toward irregular structures and necrosis. Identifying disease as a gradual loss of homeostasis, rather than a sudden event, allows clinicians to intervene long before obvious structural damage occurs. Precision in pathology requires distinguishing between three terms often used interchangeably: disease, illness, and syndrome. A disease is an objective entity characterized by a specific cause or biological defect. An illness is the subjective reaction of the individual to that disease, encompassing the patient's complaints and experience of distress. A syndrome occurs when multiple symptoms converge into a specific combination caused by altered physiologic processes. Conflating these terms leads to clinical errors. Successfully managing a patient requires targeting the objective disease entity rather than just the subjective experience of illness. Pathologists use a rigid sequential framework to organize their findings and communicate them in laboratory reports. The sequence begins with etiology, the study of the causal factors, the why of a disease. These etiological factors are the primary triggers responsible for the initial lesions in a tissue. The sequence then follows the causal factors into pathogenesis. Pathogenesis describes the specific mechanism, the how, by which those causal factors produce physical changes in the body. Defining this mechanism allows modern medicine to interrupt a disease process before it results in irreversible damage. Once the biological mechanism of pathogenesis takes hold, it eventually leaves behind physical evidence. This evidence constitutes the third step in the sequence: morphologic changes. Lesions are the characteristic structural changes produced in cells and tissues by the underlying disease. Clinicians evaluate these lesions macroscopically with the naked eye and microscopically to observe changes in cellular architecture. These structural changes dictate the functional outcome for the patient, determining the clinical significance of the condition. Clinical significance is divided into symptoms, which the patient feels, and physical signs, which the clinician discovers during an examination. A patient's outward signs and symptoms are merely the final downstream echoes of an initial etiological event. This completed sequence, from etiology to pathogenesis to lesions and finally clinical significance, forms the standard analytical model for all medical practice. Applying this sequence to a patient's case allows a clinician to answer three critical questions. They determine the diagnosis, defining what is wrong, the prognosis, predicting the likely outcome, and the treatment, determining what can be done to assist the patient. Effective medical intervention relies on the ability to reverse engineer or halt this exact pathological sequence. This rigorous approach to medicine was championed in the late 19th century by eminent founders of modern practice like Sir William Osler. Osler provided a clear mandate for the profession, stating, "Your practice of medicine will be as good as your understanding of pathology." This relationship remains the central reality for every student preparing for clinical work in the wards and clinics. Mastering the scientific vocabulary of human suffering is the mandatory first step in learning how to alleviate it. Mastery of these pathological principles constitutes the permanent foundation of a physician's clinical career.